This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue as
Enter the
opposed to
second.
health first or
Medical Dilemma.
Hi, I'm Sunny Del Rosario and you're watching Medical Dilemma. Most healthcare practitioners acknowledge that the doctor-patient relationship wields significant power that can vastly improve a patient's health. This fiduciary bond is paramount to curing a patient because it allows for more accurate diagnosis and optimal treatment. Coupled to this sacred link is the obligation of confidentiality. As one of the core responsibilities of healthcare providers, confidentiality enjoins healthcare professionals to keep a patient's health information private unless the patient consents to releasing the information to others. Thus, we could say that, more often than not, in our doctor, we place our trust. In today's show, we examine questions that concern the physician-patient relationship and the confidentiality duty. Joining me for our first segment is Dr. Minerva Calimag, current president of the Philippine Medical Association. Welcome to the show, Dr. Calimag.
Hi.
Yes. Okay, first question is, how are you in the Philippine Medical Association?
Well, the Philippine Medical Association, I should say, is in good hands.
And what have you been busy with? What has the PMA been doing so far?
What we have actually instituted now at the Philippine Medical Association is to actually go down to the grassroots. We want each and every member of the Philippine Medical Association to be really feel that they are really part of the organization. These are things that we're actually doing. We're actually going around the country and, well, actually...
Okay, well, that's very good to know. Okay. Now, for today's topic, we'll be taking a look at the physician-patient relationship. And my first question is, how has the physician-patient relationship model evolved over time?
Okay. Before, the model is one of a paternalistic model, where the physician would always say, doktor, bahala ka na, alam mo kung anong makakagaling sa akin, ikaw nang
sometimes say that myself.
Yeah. Mas ikaw ang nakakaalam kung ano yun dapat gawin, no? But then, over time, this model has evolved into something else. Why? Because now information is freely available in the internet. Even before a patient and/or relatives come, no, for a session with the physician, for a consultation, they already have some things in their mind, no, and there are already questions that they want to ask, and therefore it is necessary now that the physician should be have the communication skills to be able to tell the patients.
Okay, so what you're saying is patients now are becoming more discerning of
more informed,
the recommended medications or procedures that doctors tell them that they should be undergoing.
Yes.
Okay, and have doctors been actively promoting this idea that patients should actually take the initiative to ask their doctors more questions, to probe deeper into what they will be undergoing?
Yes, now the doctors are doing that. In fact, they're saying, do you have any other questions? Do you have any other concerns? But corollary to this fiduciary or trust relationship is also, I think, the patient telling the doctor everything about his condition, like medications that they're taking. Because if you withhold information from the physician will also not be able to make the correct diagnosis, or give the proper treatment, or even if they give the proper treatment, For example, patient is taking a medication that he is not able to tell his doctor about, and then this medication will now interact with the medication that the physician is giving.
Yes, that leads me to my next question.
There will be drug interactions,
right.
and then they are going
Adverse
to
reactions
blame
to
the they're going to
medication.
blame the doctor for prescribing a medicine
I see.
or a particular medicine to
I see.
them.
So that leads me to my next question. Effective communication between the patient and the physician is probably the fundamental ingredient in having a good relationship. But of course, there are some barriers to this effective communication. So how would a doctor try to overcome those barriers?
I think the first thing that, as we have said, no, we have to develop a trust relationship, because unless that is there, no, the effective communication will not happen.
Now, let's go over to the confidentiality duty of healthcare practitioners. What role does it play in the physician-patient relationship?
There are actually two, not just confidentiality,
Yes.
but privacy and confidentiality.
Privacy and confidentiality.
Yes, when you talk of privacy, you talk about the patient's identity. So everything has to be private. If you discuss, for example, even in fora, like scientific fora, case discussions, you don't actually reveal the patient's name. You only give the patient's, let's say, initials, and then gender, and then age, because those are necessary. Age and gender are, of course, necessary data that will be, that we need for diagnosis.
Okay.
But
Go
when
ahead.
we talk of confidentiality, then we talk about patient data,
Patient data.
patient information. So you don't reveal that to anybody.
I
So
see.
physicians should not discuss their patient's condition in elevators
All
or
right.
in...
Well, sometimes hear some.
Yeah, that's why we should not do that. Perhaps you have an area in the hospital, a doctor's lounge, where only doctors...
and patients can go in and discuss
Yeah,
their...
so if there are patients there in the doctor's lounge, you don't discuss patients too. So,
see.
but if the patients are out and you're just doctors actually trying to talk about possible solutions to difficult medical dilemmas,
Cases.
then you can do that.
Okay. Are there exceptions to the privacy and confidentiality obligations of a doctor?
I think you'll have to ask the patient's consent for if you want to give out any information about him.
And could you give an example of where you could not really waive but not observe the confidentiality or privacy obligations of a physician?
In certain instances, like for example, in an epidemic, if there's an epidemic, no, usually we waive the confidentiality clause, but still we do not reveal patient identity. But okay, there is, for example, an ongoing epidemic, and there are so many patients that are already
So what if,
afflicted and
yes,
things like those.
yes, what if a law requires mandatory reporting?
So in that case, the patient has to sign a waiver.
The patient has to sign a waiver.
Yes, yes, the patient signs a waiver. Like for example, in HIV, because that is required so that you'll be able to contain the condition.
Can a doctor refuse to observe the mandatory reporting law and use confidentiality as the argument against that?
I'm not so sure.
Okay, maybe we'll have to ask our lawyer
Yes.
later in the next segment. Okay. But I was just curious, as to how doctors would balance between the needs of confidentiality, privacy,
Versus
and,
public health
and-
issue.
yes,
Yeah.
and mandatory laws. Now, if a doctor decides to, well, anyway, let's talk about something else. Informed consent. Okay, what is
Okay.
informed consent? most people, I mean, common people like me really don't understand, what is this?
If a patient has to undergo a procedure and or be part of a clinical trial, for example, we need to get an informed consent. And there are several elements. And informed consent means that your patient agrees that you will give him or her a certain procedure, do a certain procedure in him or her, and that at any time, no, this is on a voluntary basis, and if you want to say, okay, I don't want to undergo the procedure anymore, you can withdraw anytime, but you have to be able to at least give the patient a picture about what are your expectations, what are the risks involved, magnitude of risks, for example, or duration of risks, if there are any. And then, of course, you tell them about reasonable expectations and benefits from the procedure.
Is there a set of criteria that patients and doctors can use to establish that adequate information has already been provided?
Well, as we have said earlier, the doctor can always ask the patient if he or she has any other questions aside from what has already been given.
Okay. What if a patient expressly or explicitly refuses to
I don't
divulge
want that.
some aspect of his personal life, maybe?
Well, you have to circumvent that. Of course, we do not know how much our patients actually reveal to
Are
us.
saying, yes, or they could be lying altogether.
Yes,
Okay.
some do. So you have to be astute actually as a clinician. Like in one instance, I entered the patient's room to do a pre-op evaluation because I'm an anesthesiologist. And when I entered the room, I saw that the patient is exophthalmic.
Okay.
So I told,
Could you define what that is?
I mean, you know, bulging
Bulging
eyeballs.
eyes.
Yeah. So
Okay.
I told her up front and said, you have a treatment for thyroid? And she said, yes. And where are you getting it? At another hospital. And she withheld that information
Okay.
because she wanted to have her operation done.
I see.
So,
I see.
but you know, if you're an astute clinician, you can immediately spot these little things and catch the patient at the outset.
I see.
So if I ask, do you have any condition? You know, she might say, no, but
No, right, that's right.
but I say, since when have you been having treatment for thyroid?
So you,
wala,
you
hindi na siya
assume,
makalusot.
and then sometimes they succumb to the assumption that you make.
Yeah.
I see. Are there some kinds of healthcare interventions that require only some sort of reasonable discussion between the patient and a doctor? You know, something that does not require extensive, probing and investigation on the part of the doctor.
None. I think we should be able to tell our patients what to expect.
Okay, well, so all interventions require
Some
full
patients will
from
tell
patients.
you, I don't want the bad news, things like those.
Yes, yes.
So what is bad news for you? You can always ask.
I see.
Some don't like, for example, their relatives to know, and then they might ask their relatives to go out and step out of the room while I discuss something with my doctor. So that's perfectly all right.
I see. Well, okay, you spoke about family members, no? Informed consent, does it involve also the family members of a patient? Could the doctor go to, let's say, another member of the family, aside from the patient, to ask some questions?
There is what we call principle of autonomy and in ethics.
Yes,
And
yes.
at that point, I think the patient should be able to decide for himself what needs to be done. But of course, that is considering that he has an informed mind. Because
Okay,
sometimes,
so we call this the competent patient.
yeah.
I see. Okay, now going back to informed consent, are there cases where you require explicit written consent
Yeah, for surgeries, we do.
for surgery?
Yeah.
Okay. Now, how does it apply to children, informed consent?
For children, because they are minors,
Yes.
we have what we call assent.
Assent.
So yes, if they're age of reason, above 7, less than 18, they can already give their assent. But even then, the guardian should be able to sign the informed consent as well.
I see.
So you still have an older person, a guardian or a parent, who should provide an informed consent.
I see. Well, thank you so much, Dr. Calimag, for sharing all of that information for our viewers today. It's time for our commercial break. Don't touch the dial. We'll be right back. Okay, thank you
Okay,
so
bye.
much for the...
Many of our products were designed to be used in industrial and medical economy.